Hi guys, it's your girl Lydia PC here, back again with another educational, motivational and inspiring video. If you're new to this channel, please feel welcome. I am glad to have you and I hope you'll find my content encouraging as much as it has been inspiring to me and to my subscribers. And to you, my subscribers, thank you so much. Guys, you know I love you and I appreciate you for continuing to spread the word about my channel and sharing the links to your social media networks. Now, I know some of you have been messaging me, calling me to ask me, Lydia, what's up? Why are we not getting videos anymore? I know, and I am so sorry. It's been a while. I think it's been almost maybe 7 months since I last uploaded a video. And life sometimes happens. I just couldn't. If you follow me on Instagram, which I encourage all of you who are watching these videos to go to Instagram and follow me. I go by my names, Lydia MPC. So if you do follow me on Instagram, you are aware that I recently lost my father. And it has not been easy. My father was on I cannot even speak when I start thinking of him. But my father was not only a dad to me, but he was my mentor, he was my friend, he was my confidant, and interestingly, my fashion designer as well. Most of the time before I even went to conferences or something, I would consult with him. Dad, how does this look like? Is it presentable? And so yeah, my father was my person, and losing him was a big blow to me, and it has not been easy trying to, accept life without him. May he rest in peace. And while he might not be here physically, I do know that his spirit continued to live in me, and I hope that God can help me even accomplish, even if it's a fraction of what he did, because his work with community empowerment, with spiritual mentorship just inspires me, and I'm hoping to continue with his work and have as much impact as he had on other people, especially those in the underserved communities. So yeah, I want my channel to be a mini medical school for you, where you can come and learn for free about medical or health topics that will empower you such that you will be able to make informed decisions. So when you go to your doctors, you're able to ask the right questions, or more so when you're diagnosed with something, you will know how to manage it. But most importantly, even before you get a diagnosis of something, how do you prevent yourself from becoming very, very sick? Let's talk about how do we prevent ourselves from developing hypertension, or how do we manage our hypertension without using medication. Okay guys, welcome back. It's Monday and we're learning medicine on Monday already. So high blood pressure, this is something we hear about all the time, every day. A lot of people have high blood pressure, and today I just did a quick search on the CDC website, and they say that about 116 million Americans are suffering from high blood pressure. That's a huge number, and that is just America. So what about around the world? And while we might be talking as hypertension or high blood pressure like an everyday thing, it is not an everyday thing. It is one of those diseases, just like diabetes, that we call silent killers. What does that really mean? You might have high blood pressure and you're asymptomatic, meaning you're not showing any symptoms. You feel good, no headache, no visual changes, nothing. You're okay, you're exercising, you're fine. But then your blood pressure continues to build and to build up without you realizing. And by the time you start showing symptoms, then it is too late. Sometimes it's too late. Sometimes you'll have to be on medication for the rest of your life. So it's a big deal. And why is it a big deal? Because blood pressure, high blood pressure, can damage your organs. For instance, so think of a water pipe as your blood vessels and the water as your blood. So we do need some pressure to be able to circulate blood around our body, okay? So that we can take nutrients and oxygens to our organs, so you can have a good functioning heart or a good functioning kidney or even a good functioning skin, the largest organ in your body, so that you can radiate and glow. You know what I'm saying? So we need blood pressure to do that. However, we don't want it to be too low, because then the organs will miss oxygen and nutrients, and then they'll start dying. But also we don't want it so high, because guess what? The high blood pressure, the high pressure in the blood vessels will go and destroy the tiny blood vessels that actually supply our organs. For example, in your kidney, so if there's high blood pressure, it's going to damage those tiny vessels, the arteries or arterioles that take blood to your kidney. And then guess what happens? You get kidney damage, and then you end up in dialysis or just dying from kidney failure. In medical terms, they call it renal failure. So blood pressure is a big deal. Another example, it can lead to destruction of the vessels in your brain, and then it leads to something we call stroke. I know some of you have heard of stroke as well. These are serious diseases. They can lead to deficits that can be life-changing. Some people who have stroke cannot even talk. They have to learn how to talk like a baby. You have to start learning how to eat. Sometimes even how to chew and how to swallow. So these are diseases with serious implications, and most of them are the result of blood pressure, something that you and I can prevent. Okay, so another disease that can happen, it's called aortic dissection or aneurysm. So because of high blood pressure, that blood vessel called aorta that supplies your entire body with the blood and oxygen and nutrients, it starts rupturing. It's like a pipe gets destroyed, and then all of a sudden it just bursts. This is a medical emergency and it's death. And some of these things are due to long periods of high blood pressure. So what can you do to prevent yourself from suffering the long-term impacts of hypertension or high blood pressure? Actually, so how do we define high blood pressure? So according to the American Heart Association, we do have the systolic, the higher number, and the diastolic, the lower number. So if you look at this chart over here, you'll be able to see, so if your numbers are above 129, then you're getting towards the first stage of hypertension or high blood pressure. And then above 139, 140 and above, then you have hypertension. So how do you lower your blood pressure without using medication? Number one, exercise. And it's exercise with the intent to lose weight. Okay, Lydia, I know you're like, man, we hear about exercise all the time. It's hard to be disciplined. I know. I try to be disciplined. Sometimes it's just so difficult. But it's good to be aware of this information again so that we can get empowered to know what to do. But research studies have shown that if you lose 1 kg, that is 2.2 pounds, you're going to lower your blood pressure by 1 millimeters of mercury. So let's say you have been diagnosed with hypertension or high blood pressure, and your pressure usually ranges around 150, okay? Systolic, the higher number, and maybe around 80, the lower number. So what do you do to lower that systolic number to 130, or to below 130, so that you're not in the category that is considered a formal diagnosis of hypertension? So if you lose 10 kg, that is 20 pounds, then you lower your blood pressure by 10 points. So exercise with the intent of weight loss is very important, okay? So that's one bit. The other way in which you can modify your lifestyle to be able to manage your blood pressure and to prevent your blood pressure from being so high is diet. Again, I know you're like, oh, Lydia, man, here we go again. I know, here we go again. It's so difficult to maintain a good diet. But studies have shown that there's this approach to managing high blood pressure that is called DASH. So using dietary approach to stop hypertension, yeah? So it's just using your diet to prevent yourself from developing high blood pressure or to lower your blood pressure. Already? Okay, so let me summarize the study to you. We have Lydia, we have on PC, same calorie, same salt content, just different sources of the calories. Studies have shown that the patients who eat DASH diet is able to lower their blood pressure by about, on average, 6 millimeters of mercury. That's a huge deal. So if someone's blood pressure is around 135, so if they lower it by 6 points, then they're going to get to 129. That's a big deal. That's a different category of blood pressure classification according to the American Heart Association, and that will make a big difference in somebody's health. So these things are serious, and that's why I wanted to inform you about the existence of the DASH diet. It's very important that we stop talking of blood pressure as if it's an everyday thing, and it's important for us to recognize that it is not an everyday thing. It is a silent killer. It is a serious disease that can lead to kidney issues, heart issues, brain issues, nervous issues. So it's a serious thing that we need to take seriously. And the good news is that there are things that we can do within our reach to prevent ourselves from developing high blood pressure or to lower the blood pressure. Keep trying your best. Continue educating yourself by subscribing to this channel, for instance, and reading other articles as well that I'm going to link down here below. So outside of that, what questions do you have for me? Please comment down here below with your questions. Feel free to message me on Instagram at LadyOnPC, and feel free to call me too if you have my number. I appreciate you guys. I love you. I am here to empower you with health information that that you can use for your benefit. Other than that, thank you so much and have a wonderful week.